My personal message to you all, this is real. This is the worst that we've seen so far. The virus doesn't care how you vote. The virus doesn't take its cues from social media. And the virus doesn't engage in conspiracy theory. The virus knows that it wants to live. It knows best who is willing to host it so that it can grow and replicate and change. If you no longer want to wear masks, if you want our nation to get back to normal, if you want to go about your daily lives as before, then please, for the time being, wear a mask, maintain social distancing, and get vaccinated.
This pandemic has stressed our operations. We are doing our part to maintain a safe environment in our hospitals. We are now imploring our community to slow the spread of COVID-19 by taking the appropriate safety measures to protect themselves and their loved ones. The recent increase in coronavirus cases have impacted both the community as well as our hospital staffing levels. We are facing yet, as Mark indicated and Penny indicated, another surge. And the mental and physical toll this pandemic has taken on the healthcare staff is becoming more and more apparent with each passing day. Undoubtedly, staff are growing increasingly disheartened to again see such critically ill COVID-19 patients when there are in fact preventative measures, such as getting vaccinated and wearing masks.
You know, I was introduced as the Chief Medical Officer at French Hospital, which I currently am, but prior to that, for 25 years, I've been a critical care physician. And in all my years, I have never seen anything like the COVID-19 pandemic. The COVID Delta surge that we are currently experiencing has caused a great influx of patients all of a sudden into our hospital, in the emergency department, the medical floors, and the ICU. This has caused an increase in volume and acuity for the nurses and physicians. Now remember, these are the same nurses and physicians that have been doing this since March 2020. They are getting tired of this. Their efforts are amazing, but like all of you in the community, they want this pandemic to end. We have seen too many people succumb to this illness. We have also seen firsthand the devastating impacts that it has on those who survive. We want a healthy community. We don't want to see avoidable cases come to our hospitals. You can do your part by getting your vaccine and wearing a mask while you are indoors or in crowded places. As Penny Bornstein mentioned, masks are a well-studied way of suppressing viral spread. And this, in combination with the vaccine, will bring the surge down fairly rapidly.
Right now, we have far too many patients in our local ICUs who are critically ill with this preventable disease. This is exhausting our county's medical resources, making it more difficult for us to care for people with other conditions like strokes, heart attacks, trauma, and cancer. The science is clear that wearing masks can slow the spread of this disease. We also have safe and effective vaccines that are readily available to our community. We've already lost too many people in San Luis Obispo County to COVID. Please, help your local healthcare workers end this pandemic by wearing a mask and getting vaccinated.
We are in the hospital. That's the end of the line. We're not going to be able to do anything to prevent the disease once people end up in our emergency departments, in our hospital beds, and in our intensive care unit beds. And so we know that staying away from people when you're sick is important. We know that social distancing is important. We know that masking is important and works, and we'd like to see people return to doing that as not only as a way to protect themselves, but to protect others, because we know that there is a significant portion of this disease where people will spread disease before they even know that they've had it. And we know that getting tested is important as well. All of these services are available. And most importantly, we know that vaccines are effective and work. And we have great correlation between the populations that are unvaccinated and how frequently they end up in the hospitals. So we know that vaccines work, they're safe, they're effective, they're FDA approved. And we would encourage everyone who's eligible to get vaccinated and return to indoor masking.